Good morning. Good morning to you, our viewers, once again. Today is Saturday, 10th October 2020, and it's another edition we're bringing to you, another edition of Schools Are Closed, but it is not a holiday. Schools are closed, but it's not a holiday. It's an initiative of Savannah Signatures with the support of Educans International. The aim, once again, of this particular initiative is to ensure that children of school-going age, every child that has been displaced by this COVID-19 pandemic goes back to school safe, sound, when schools reopen. Since Thursday, we've been coming to you with critical issues around mental health. On Thursday, we talked about self-care practices. It was basically around how to take care of your individual self, ensuring that your mental health is secure, that you are in a safe place. Yesterday, Bridget brought to you a discussion on postpartum depression. And yeah, even though I was not here, I followed through and I learned a lot from it. Today is actually the day the world has set aside to commemorate or to discuss issues around mental health. We've spoken about what health means to each and every one of us. We've spoken about what health should be. We've again delved deeper into the topic proper to discuss what mental health should be all about. So today, to top it all off, we have individuals from the Ghana Education Service and then from the Ghana Health Service in the studio with us to discuss what mental health stands for in their various institutions. I'm not too sure I can do justice when it comes to introducing them. So when I'm done with my little prelude to this, I'll give them the opportunity to briefly tell you who they are. Please, COVID-19 is still real, even though we feel like, yeah, the restrictions have been relaxed and then we feel we can do anything and everything. COVID-19 is still real. It is still out there. Somewhere else, it continues to create a lot of mess in society. People are still dying. So please continue to wear the mask like we are doing currently in the studio. Please wash your hands under running water. Don't forget to use soap. Soap is very important. Carry along a sanitizer anywhere you go, alcohol-based sanitizer. And please also, now that we're going to the churches and the mosque especially, let us practice a safe the distancing protocols. Thank you very much. So today we are talking on the theme for this year's celebration, which is mental health for all. Mental health for all. Let me come to my studio. I have three gentlemen, like I said. I'll start from my immediate right. So our bosses, if you can briefly tell our audience who you are and where you work and what you do. Thank you.
Thank you so much. I am Dr. Mustafa Al-Hassan. I'm a senior lecturer from University for Development Studies with the School of Allied Health Sciences. I'm actually the head of department for behavioral sciences. And so as a lecturer, I'm interested in how education should function properly. Yeah.
Excellent. Thank you, sir. Yes, sir.
My name is Mr. Labi David K. Ejakwa. I have a long name, but
don't worry. We will deal with it.
Sure. Mr. Labi David K. Ejakwa is my name. A mental health nurse, senior nursing officer at the Tamale Teaching Hospital, and the current unit head of the unit, psychiatric units of the Tamale Teaching Hospital.
Nice. Thank you. You are welcome, sir.
Thank you.
Yes, sir.
Well, thank you very much. My name is Felix B. Yelivere. I'm a principal mental health officer in the Sanarago Health Directorate. But we are, as a directorate, municipal health directorate, we are into community health, community mental health services, where we are not able to when we refer to the higher institutions. Thank you very much.
Okay, thank you. I think you sitting out there understand at this point that so at all of these three levels, we have some interaction with children, with school-going people, and that's the most essential for us today. To start the discussion, to start off, let me ask a basic question. We've been asking this since Thursday, and I would like you to center it. It would be very helpful if you just centered on your background and then what it should mean or what it means. Why should we take mental health seriously? Why should it be important to us? I don't know which of you would like to start, but anyone can just take a stab at it.
Yes. Mental health, from the definition of health itself, it says that health is a complete state of physical, mental or psychological, and social well-being of an individual, and not merely in the absence of diseases or infirmities. Unfortunately, that mental health aspect, the mental or the psychological component, had been relegated for far too long. Because to us, if it is not malaria, if it is not typhoid fever, if it is not diabetes, if it is not hypertension, then any other condition is not relevant.
Yeah.
But we have forgotten that whoever finds him or herself in such a situation, as far as the conditions I just mentioned are concerned, might in a way be affected as far as the psychology of the individual is concerned. Fear of the unknown. When am I going to recover from such a condition? Or what is even the societal perception about the condition that I'm suffering from now? So some people die from physical condition not because they were supposed to die, but because of their thoughts, the negative thoughts regarding their condition that send them to their early grave, and not necessarily the physical condition that killed them. There was an article or story I read, not deviating from, but there's two.
Yeah.
Exactly.
Please go ahead.
Two patients visited a hospital, and they visited the same doctor, and one had a debilitating condition, but the other did not. At the point where the doctor was to give out the reports, unfortunately interchanged. The one with the raw condition had a good report, but the one without the condition had a bad report. Eventually, the one who did not have any condition died. Why did he die? That is the question.
Yeah, indeed.
The persistent or the constant thinking caused, several, destructive hormones to be released into the system. Our clinical psychologists is here. Eventually ended up with conditions that primarily they were not there.
Yeah.
So our mental health is so crucial and very important that if we do not pay premium or we do not pay attention to it, we can't achieve whatever we are supposed to achieve. Being sick, down with malaria, being down with diabetes, you are able to function intellectually, cognitively. But whoever finds himself in that sphere, as far as mental health is concerned, wouldn't be able. Judgment, thinking, everything, there are distortions all over. The individual begins to hear voices that are not even true. See things that are not there. Feel things moving on the body that are not even there. The individual could even hear voices that are commanding in nature, telling him, go kill yourself or go kill the next person by you. So our mental health ought to be taken seriously for us to be able to achieve whatever we are supposed to achieve as a people, as a nation, and as a world. Yes.
Thank you very much.
You're most welcome.
Yes, education. Why should mental health be paramount on an individual's agenda or a nation's agenda? Yes, I don't know who wants to take it, like I said. So any of you can just come in.
Yes, so like you put it, we those, for instance, we are based at the district level, at the municipal level, and at the community or the far to reach, at the periphery of. So in the whole concept of mental health, we are supposed to render first aid services.
Yeah.
Because we know that at the community level, a lot of people go through psychological problems. But so it left onto us to identify them so that it not even get to the level of the management. So by doing that, we offer, we let them come for maybe counseling in our own special way. We follow them up in a way of outreach activities. We do home visits, for instance. That is one of our pivotal roles that we undertake as a community mental health. And as I say now, for now in Ghana, we are across the country. But the unfortunate issue is that we are not being recognized. And the resources are also limited, but in our own little way, we are being felt. Because mental health as in the whole has been neglected, which we all know. So a lot of our people.
So, I mean, my issue here is this. Yes, maybe it's been neglected because we still do not understand the consequences in neglecting it. So, as people working in these very important fields, I want to have a feel of how important it is in your line of work. You know, you meet people on a daily basis. What are some of the issues that are getting reported to your outfit that make it like urgent, that makes it urgent on an agenda? Even for us sitting here today, why should we be talking about mental health?
All right, thank you very much. Like you rightly put it, mental health has its own challenges, and we all know that when you are not mentally sound, it affects your daily activities. You are not able to function very well at your work site. You cannot function at your community, as a family. You cannot function well at your everyday activities. And so when you identify the deficit in your output your productivity level becomes what? Lower. So at the end of the day, it affects how in your progress in terms of perhaps your education, or sometimes it affects even the way you are supposed to progress in life. So when you are not mentally fit, all these things come to play. So even at your work site, for instance, at the health facility, for instance, at the community level, for instance, we see women and children who are affected in one way or the other. So as they come like that, you see their mind being distorted. Some of them, their children, for instance, when you see them at a tender age, might not realize it. But if you have a careful analysis of their behavioral pattern, you may be able to tease out that no, there is something wrong with this child. Perhaps he's not able to put up well as compared to his colleagues in the class. So when you are able to identify that, then we'll take it up from there and then make the follow-up.
Thank you very much, sir. Doc.
Thank you so much. As you are aware, education is the bedrock of every nation, and we can only progress if we have a core of, students being turned out to work in the get into the work environment with a lot of intellectual thinking and abilities. However, you realize that the universities as they are, from where I'm coming from, we have issues of mental health. Students, lecturers, other staff, and other workers, including security and everybody. Now, when you look at this issue as state, you realize that we need to actually look at how holistically we can, channel out people who will be intellectually apt and then doing. However, the challenge we face in some, especially in this part of our world, has to do with our understanding of mental health. Sometimes you ask yourself a number of issues. If you see me walking and then I'm talking, I mean, you don't turn around and say, oh, this is a witch or a wizard or something of that nature. Probably it's something that is in me, I'm just venting out. So the challenge now we face in our background, our social background, also influences the way we understand mental health. Because as we are growing, the analysis stories we are told and the issues we are informed about, it actually affects our thinking, and thereby in the long run also affect our educational system, especially if you, the lecturers and others, are actually having so-called difficulty in understanding what mental health is. Then you'll not be able to assist the students to understand the way forward. So in a brief, this is what I would say.
Okay, sir. So now that we have ascertained how important this part of the health system is important, let me just probe a little here. If it is this important, from all indications, it means that if that mental state is just a little twitched, it means that everything just collapses. Why do we, I do have the sense, and we've been talking about it for a long while, and we know, Ghanaians, we have that sense that our institutions are not committed, especially when it comes to dealing with issues of the mental faculty. What is the Ghana Health Service doing? We keep talking about, Doc is here, he can tell us how many clinical psychologists we have in Ghana. So what is the problem? Ghana Health Service, I don't know if you could help us, give us some insight into the problem. Why does it feel like we're not paying premium attention to this issue?
I think it boils down to ignorance. Yes, I wouldn't say it's lack of education. We are educated. I mean, but then ignorance can cost a person or group of people or even a nation. I mean, if care is not taken and in an area where they are ignorant, about. Little has been done as far as mental health is concerned, all because of how we perceive the causes of mental illness to be. From the historical backgrounds, perspectives, they believed, or there was a belief that mental illness was caused by demons, witches, or a payback time for a sin committed by an ancestor who died many years and is buried. As a result, anytime a brother, a mother, a nephew, or a neighbor finds him or herself in such a situation, quickly we think from these lines. So little is always being done. So if we perceive the causes to be demonic or witches, then where do you think we will send such an individual? We are the same people from the same homes. So the fact that there is the health system, it doesn't change anything until we come to terms with the reality. That is where we are going to see a change. That is the main challenge that we are facing.
Thank you.
Our perception as far as the causes of mental illness is concerned. We perceive it to be demonic.
Yeah, I guess that is why we take them to witches' camps and then prayer camps and then all of these things. Okay. Now, let me just, time is moving fast. Let me just delve into some very critical issues here. I want us to talk about the presentation of mental illnesses. What are some of the telltale signs we should be looking out for? I know for education, we have the GES, Ghana Education Service, has the guidance and counseling unit. Also, but mostly for I'll move from education, especially DOC, to Ghana Health Service. So, Doc, in your institutions, I'm not too sure how you deal with these issues, but what are some of the telltale signs that maybe your student or people around present and then you feel like, okay, this could be a challenge, we need to do something about it?
Well, in terms of mental illness, you can look at first the physical.
Okay.
Now, physical in the sense that you know how the person used to be, the way he was talking, the way he walks. Now he has some peculiar way of doing things, or which society may consider as odd, and then the person is now meant. So these are physical things that you can see. For instance, you could see somebody walking and then throwing his hands, in a perpetual way for about 2-3 minutes or so. Or he stands in a stupor, he stands somewhere for several hours without movement. And then you begin to ask yourself, why is this person behaving this way? These are physical symptoms that the person will be talking, and then you can look at you can see that no, the way the person is talking, there's something wrong. On the other hand, you can also look at the emotional. Now, there are issues that probably is just a colleague who is just joking. And then somebody takes it very seriously. And to the extent that it can, he manifests himself of crying or doing other things. So these are emotional things that you can also look at in students and realize that, no, there's something, wrong. That's not normal that this person. But let me put a caveat to some of these things. Now, don't jump into conclusions by the fact that somebody is behaving in another way. You need an assessment. And even the location of the person is also very, very important. Assuming I come to peep through your window and you are there dancing and the rest, I say, no, there's something wrong with you. You are not even aware that I'm looking at you.
Yeah.
So the location is also very important.
Okay.
How the person dresses. If he's in his bikini or some this and he's in the beach, it's different. But if you find that you are on the Tamale Street and you are in your bikini, then we'll begin to ask ourselves. So depending on the location, the dressing, the speech, you will need to, I mean, sometimes you see people who are actors, the way they act. I say, oh no, there's something wrong. No. He's doing it to entertain people. So these are some of these things that you need to look at: the physical, the emotional, and sometimes other psychological issues. Yeah.
Yes. Boss, do you have any to add to?
Yes, like Dr. rightly put, generally speaking, there are the symptoms sometimes manifest. We have a duration for it, so you need a critical assessment before you can conclude. But sometimes you see that some people, when their mind are beginning to be distorted, they become paranoid, for instance, begin to accuse people of the cause of their problems, which you and I might not be the target. So they keep on pointing fingers to a certain particular group of persons who are supposed to be the cause of their problems. And sometimes, like, the perceptions are also so high that it affects their ability to cope in society. So sometimes, like David mentioned, sometimes you have hallucination. You begin to think outside. You begin to see certain things that I and you, ordinary, we might not be able to see. We'll be hearing some voices commanding us, directing us exactly what to do. Sometimes in our own way, we sit and then we assume that you are the cause of the problem. So you blame yourself so much. You blame yourself for every little thing that has happened. And sometimes one is not able to maintain relationship. Because as in the institution, for instance, all the time you are having problem with your colleague. You cannot keep a relationship for a week. So at the end of the day, you realize that you fight with everybody in the school or in the class, at the website, you are not able to maintain. So you should know that no, there are issues. There are issues, but like Doctor said, you need to critically assess them and then give a time duration before you can now conclude. And sometimes you have a poor sleeping pattern. You are not able to eat, for instance. You are not able to function. You lack the interest. That certain things are there, you were having the interest of doing, but all of a sudden you have no interest. You want to be alone. Of course, at the end of the day, at one point or the other, we all need to be alone. But sometimes when it goes to above the threshold, then you know extreme. They know that there is a problem. So there are a vast lot of signs that we should be looking out to.
No, okay.
Thank you.
Brother David.
Yes.
Anything you want to add?
Yeah, basically, signs and symptoms we cannot mention, and it differs from person to person and the condition that they might have at a particular point in time. Yes, so their sleep pattern, quite a number, their sleep pattern might be, disturbed. Either they sleep too much or they do not sleep at all, especially with depression. Yes, some of them might see food as a no-go area. They have to, starve themselves.
Wow.
We call it hunger strike.
Oh.
Yes, they don't have any interest in food, so they decide to starve themselves. Some of them, like the perceptual distortions that you're talking about, they perceive things that are not real. We call them hallucinations. And they perceive them using the senses. Yes, so sensory perceptions without any proof, without an external, stimuli.
Could you just explain that a little bit?
Yes, so they are hallucinations. We call them, what it means is that it's a sensory perception. The individual perceives using the senses. So the person can tell you they see this, but the thing is not there. The person tells you objects are moving on my skin, but there is nothing. The person tells you I can hear a loud sound, somebody mentioning my name, but there is no one calling them. Yes, the person could taste something, and misinterprets or tells you that the real taste of the pen will be changed.
Yeah,
exactly.
Something totally different.
Exactly.
Okay.
So these are the hallucinations that I'm talking about.
Okay.
And some might also, we call it delusions. Yeah, delusions simply mean false beliefs. Yeah, false beliefs which you cannot even, after giving out the proof that they tell you, I am this or this is this. And it's fixed. Even after you have provided all the evidence to let the person, to help the person to change the belief, they wouldn't. They still go by whatever they have told you. Yes, and quite a number of them also begin to have suicidal thoughts. Suicidal thoughts and ideations. The person will be there and thought of taking his or her own life, or even thought of going to, take the life of another person. Suicidal, which we have ever, witnessed. We embarked on the prisons ministry one day, and a woman had been thrown into jail. And when we started interviewing, she said she killed the daughter, 16-year-old daughter. A voice commanded her to kill her own daughter. And unfortunately, we have laws in the country that criminalize, people with mental health issues. Quite unfortunate. Yes. So these are some of the signs and symptoms that they might present. And we don't rule out the duration, because each condition and the duration that it has to, cover before we'll be certain that this is indeed the condition that the individual is suffering from. For instance, for you to diagnose somebody with depression, the signs and symptoms must last for a period of 2 weeks or even more. 2 weeks, yes. With the poor sleep, with the poor concentration, with the strong guilt feeling, losing of interest in things that the individual used to show interest in, suicidal thoughts and ideations. All these signs and symptoms must present persistently for a period of 2 weeks or more. And it must also have the capacity to affect the individual's areas of functioning. Areas of functioning simply means the physical area of functioning. The individual will neglect the self-care. The individual will neglect the social relationship. It means the social aspect of the individual is also cut off. And the occupational functioning will also be disturbed. The individual will refuse to go to work. Yes, for reasons which is only known to. Exactly. So these are some of the signs and symptoms that we think we can.
It's getting interesting in here. It's educative. I'm learning quite a lot about mental health, the conditions, and then how they present. Yes, thank you once again, gentlemen. We will just run for a quick breather. We need to powder our noses and do some little things and then come back. So it is still, schools are closed, but it's not a holiday. We will be back in a second. Thank you. partnership with Educans International. So we are in our third day of this mental health crusade that we started on Thursday. The crusade itself, these 3 days have been brought to you by Savannah Signatures, Tolek GH, and then Basic Needs. When you take a critical look at my set, you will see that we have a new face in here. Yes, we will give him the opportunity to quickly introduce himself to us. Welcome, sir.
Thank you very much. My name is Dokurugu Adam Yahya. I'm the Programs Manager for Basic Needs Ghana, a mental health and advocacy non-governmental organization that works to support persons with mental health conditions and their families.
Welcome once again.
Thank you.
So yes, fast forward. Now COVID-19. We've been talking about the social consequences of COVID-19 since forever. Yes, we had some discussions around, implications on children in school, because schools are closed, on parents, because now they have to keep children 24 hours, 7 days, something they are not used to. We've discussed how teachers also now are outside the school, how COVID, how all of these mental issues come to play because of the implications of COVID-19. Once again, just for the sake of educating people, educating the young people especially who are watching us, I would want us to again talk about the mental health consequences. I feel like we can never discuss it enough. I don't know if that makes sense, because mental health affects everything. So we can never say we are overdoing it. What are the consequences, mental health consequences, that COVID-19 has brought in its wake? Maybe Mr. Dokurugu could start that discussion for us.
Thank you very much. COVID-19 has had a serious impact on the whole world, globally. The whole world has been impacted. Systems have had to change all of a sudden. New ways of life have been introduced, new regulations, and things are happening so fast that globally there is so much uncertainty and about what the next day or the next couple of weeks, how things are going to be is really uncertain. And you will realize that we're saying that COVID-19 have implications on mental health of millions of people around the world. First of all, it sprung at us as a surprise. So nobody was actually prepared for it. So the fact that everybody was caught off guard is in itself disturbing. It's destabilized so many people, it destabilized nations, it has destabilized families, it has destabilized individuals. It has distorted systems, and so there is so much chaos in the system. Nobody can say that in the context that we find ourselves now, you are actually in charge of anything. So our lives for now has been very reactionary. We are responding to something that we were not prepared for. Right. So within this uncertainty comes issues of fear. Fear of the unknown. And I believe that nobody is too old to be afraid, or nobody is too young to be afraid. I think that if systems could feel, which they actually feel because they respond to circumstances, okay? So if systems could feel, and I believe they do, then we can see that there is fear in everybody. So we are afraid, and some are able to voice out their fear. Others are unable to voice out their fear. Okay? Fear of the unknown. What will tomorrow hold for us? So, in terms of our families, we don't even know when our children are going to school. That is uncertainty.
Yeah.
That is disturbing. That is disorienting. Two, if you look at us as a country, we don't even know. Our plans are contingency plans to be able to contain the situation. Okay, so that is a source of fear. Now, even the fear of not knowing why are we seated the way we are seated. It is because we are afraid that I may have the virus and I may infect David, or David might have it and might infect. So the fear of getting infected is in itself, something which is very impactful. Beyond that, there is a lot of anxiety, and that closely relates to fear. People are so anxious about life in general, about what they may experience. We see all these images and all these stories, and they even go to compound, the anxiety. And sometimes even the fact that we no longer know what to believe, is in itself, a source of anxiety. We have been told that our numbers are coming down. Our numbers are coming down. But do people really believe when we say that the numbers are coming down? So that is a source of anxiety. We have issues of isolation. When people think of the fact that one of the ways we've been asked to behave to protect ourselves and protect others is to, as much as possible, stay at home. So if a person's life was lived most of the time out of the house, and now you are requested to stay at home, you see that as isolating yourself from your usual way of life. So that in itself is isolation before the isolation that comes when a person is actually confirmed to be suffering from COVID-19. So that is also a matter to look at. We've been talking about social distancing. I think it is an issue that even needs to be discussed further. So where we need to set apart from one another as a safeguard. But beyond that is that sort of gap that is created between us and the people who matter to us. That loss of social connection, is even more disturbing than the physical space we keep between ourselves. How have we lost? How have I lost connection between me and my loved ones? And then that these are the things that we refer to as what? The new norm. There is emotional trauma. I listened to a story of a woman who said she lives in the community up north. The children are in Kumasi. And when she heard that the children, there was COVID-19 reported in Kumasi, the fact that her children are there, she collapsed. Okay, and this is going to change her life. Anytime she hears about COVID-19, until her children are back home, she will go through a certain emotional disturbance. So for me, these are some of the impact that we can talk of. Looking, in fact, globally, it is estimated that it is going to affect economies. And it is already affecting economies. People are not able to work, so productivity is going to go down. Our country has, we have to go for $100 million support. That is an economic cost. We are talking about providing additional incentives so that frontline workers can be motivated. That is an additional cost. If you look at the number of people whose lives are lost to COVID-19, that is taken away from the human resource contributing to productivity and the economic growth of society. All that is going down the drain. So, and even the fact that we have to divert resources to respond to COVID-19 is in itself an economic cost for the nation.
Thank you so much, sir. I mean, the distraction is a lot. The disturbance is huge. Unfortunately, like he said, it's become the new normal. It's become a way of life now. The only thing we can do now with regards to COVID-19 is to be sure that we are safe. Yes, the mental health part, I mean, we're just grateful that we have systems in place to take care of the mental health aspect of it, whilst the others work on finding us a cure or an antidote or whatever it is that we need in order to build this kind of, maybe some immunity against the virus and all that. That takes me into my next question, and I'll come to Ghana Health Service first. What kinds of support is there for people who have mental health challenges? So all the issues that Mr. Dokurugu just mentioned. Someone comes to the facility, you know, with presenting such, you know, maybe a few of these conditions. What systems, what measures has the Ghana Health Service put in place in order to take care of someone like that?
Yeah, thank you. The approach to the care that you render to people living with mental illnesses are holistic in nature. Holistic in the sense that we do not approach it from just a single line.
Okay.
Yes, the health professionals are needed. The family systems are also to come on board. The government and the various stakeholders, like the NGOs, basic needs. I'm happy Mr. Adam is here because they have played a key role as far as caring for the people living with mental illnesses are concerned. They have the structures and the systems in place to meet their needs, not just the medication that they will need for recovery, but the social support, making sure that the support group, they have created various support groups, skill, giving people who once suffered from mental illnesses and they have now recovered. What are they supposed to do? Do we leave them to their fate because they have now recovered? No. They give them skill so that they can continue, in their livelihood, to be able to make ends meet. So the holistic approach that I'm talking about, an aspect is the one that I've just narrated. And the physical aspect. The physical aspect has to do with the medications that we give to them. The first two that we use. Yes, because if somebody comes to the consulting room very hostile and aggressive, and no one is able to get closer, we don't use physical fight to tame them. It's the medication that we use. So that is it's under the physical therapy. The physical therapy, we use the medication. And the social support, one aspect is also the family. So the family must understand what the condition is all about. We need to change their perception as far as the condition is concerned. From my earlier submission, I told you that it was something that the whole world believed years back, but even now, under the scientific era, where we've been able to ascertain causes to mental health issues, people still believe that it's caused by demons. So until we change that belief, it will be very difficult for the family to accept that relative who is suffering from, the condition. So these are the various approaches that I think, and the psychological, component of it, where we engage the individual, either one-on-one or in a group, to help change their way of thinking. Because if your way of thinking is negative, then eventually it might have, an adverse effect on you as far as your mental health is concerned. So we help them change the way they think. Exactly.
Thank you, Mr. David. Doc, our boss just said for everything to get better, we would have to change our mindset. How do we go about doing that?
Thank you so much. In psychology, we have what is called cognitive behavioral therapy.
Okay.
This cognitive behavioral therapy deals with, when we say cognitive, we're talking of the thinking process. Then the behavioral aspect has to do with the activity the person does in respect of what is going on.
Okay.
So there are a series of activities that, as a trained, clinical psychologist or psychotherapist, you are able to get the person to go through over a period of time. Let me just give an example like what we call maybe systematic desensitization. Now, the person has so much fear of getting, COVID-19 to the extent that for every single thing he does, maybe coming here, he will not touch this table, he will not, whatever he does, he will go and wash his hands. So for every few seconds, he touches the table, he door handle, you even, put your hand, and then the next thing is to go and wash. You can imagine such a situation, the person, will have a problem, because continuously washing your hand every 10-15 minutes over a day, you get sores here and there. Now we can employ things like, cognitive behavioral therapy. Specifically, you can do what is called systematic desensitization. Now you get a person to understand the issues first, why the person is behaving that way. Then you find a way by which you can allow the person to realize that yes, as for getting COVID, you may or may not get it, but it's not the serious every 10 minutes washing of your hand that would exist. So when you get people through it, you are able to change the way they are thinking. So it's a whole series of programs that are designed, and depending on the specific nature of the problem, you deal with it. And usually it's done by trained personnel. I mean, you cannot sit over here and give a whole series of diagnosis and then therapy for every single person. And that is why I'm happy when David was talking. He says even in the hospital, you come in and then the person is behaving aggressively. You may have to give certain medications, but we don't tell the general public what medications they are. Because you might find that somebody is listening to us, and the next moment is to go and look for that medication.
Yeah.
And then now my child is behaving, my husband is behaving this way. Now, fine, I have to give you this medication. That is the source of this thing. Yeah. So usually, we have to get through. So it's important that as we say you need the help, if there's a problem, you need to attend to a specialist. You need to go to a hospital where we have these trained people who will understand your issue. We also see that there are, in our religious setting, there are people who understand what mental illness is. You could still go to them, and then they can also, find out what to do to help you. We don't say that, oh, don't go to any religious person, because the first belief is that he needs help, and the religious person could be of help. Then the hospitals are there. We also have trained counselors who can understand your issue, and then they can then inform you that please go here. We also have institutions, mental health institutions, like Basic Need, Tolerate, and others, who are in the system and are ready to assist. If your issue, you are able to present your issue and you go and complain to them, they will be able to give you directions and other assistance, which will go a long way to be of help. So please, it's not easy, but we know that we can always do it. Yeah.
Thank you, Doc. Dr. Dokurugu, just a quick one. You are an advocacy organization. Once again, I'm looking at communities. I'm looking at the fact that still when we see anything off with someone and we think that they are a little unstable, then the next thing is to take them to church. I see take them to churches, take them to some camps, and people go there and they go through such inhumane acts. I'm still concerned about how to get that change in society, the mindset. I don't know what you do as an advocacy group. I'm sure you have at some point in your work done something around this. What would be your prescription to, it may not happen overnight, yes, it cannot, but maybe point us in some direction. How do we go about getting people to see this differently and not take someone to a church to go and get exercised and go through all of those things?
Thank you very much, and thank you for the promotion to doctor on this occasion. Right. I'm happy that David and my brother, friend, and senior mentioned that there is no unilinear trajectory to addressing issues of mental health. It must be holistic.
It means comprehensive.
Yes. So you need the family, you need the systems, and then as part of the system we have the faith-based healers. So we have the traditional healers, and we also have the spiritual healers. Now you will realize that according to the statistical service, 70% of the population of Ghana is rural. 30% is urban. And if you look at the distribution of our healthcare infrastructure, in Ghana, the 3 psychiatric hospitals are all based in the coastal part of Ghana. So we have Accra, 2 in Accra, and then 1 in the Cape Coast. Okay. Yes, Bantang, Ankerford, and Accra psychiatric hospitals. The other specialist hospital where mental health is very visible is in Kumasi. Okay, right. So for the largely rural underserved population, when a family member experiences a crisis that they don't understand, based on our fundamental belief of the cause of the illness, it determines where people go first. And as you mentioned, most people believe that the cause of mental illness is rooted in the spiritual, in the invisible. And the invisible is not the treatment for the invisible or the spiritual is not located within the confines of the hospital or in medication, but it's located in someone who can also understand spiritual things and provide spiritual prescriptions and treatment. Okay, so if a person is taken to a prayer camp or to a traditional healer, it first of all tells you what their belief system is. Now, in our advocacy, we don't condemn the practice of traditional healers or the practice of spiritual healers. Why? Because it is true that some of the cases In fact, a senior mental health practitioner in Ghana said that some of the conditions are better even handled at prayer camps, because it is not every condition that needs medication. So he says, where they are able to talk to the people and provide the needed counseling, he has no problem. Now, I said, we don't condemn people going there. What we advocate is how they are being treated there.
Exactly.
Treatment for mental health comes with a package of the person's human rights, the dignity of the person to be treated as human, to be treated as somebody who needs help. So any action that violates the rights and the dignity of the person is what we advocate against. So our support, our intervention has been trying to influence the mindset of faith-based healers towards adopting more humane ways of treating or providing treatment. Somebody comes to a prayer camp, is already doesn't already eat well. So when they assess on appetite, the person doesn't eat well. The person has a good sleep pattern, and other indicators will tell you that this person is more or less a case of emergency. Now, part of the prescription of either the pastor or the imam is that the person should fast. And having a healthy physical body contributes to, your mental sanity. In fact, when I am hungry, I easily get angry. So the person is already sick and the person is fasting. Yes. So that is one of the things. And then those who are beating. So we say that, look, why don't you partner? So our work has been advocating against this inhumane treatment, but promoting dialogue and collaboration between the formal sector and the informal sector. First of all, how do you do that? Breaking that mutual suspicion that has always existed between formal practitioners like David and then traditional healers. Why? Because, if you look at the formal sector, when they look at the prescription of the traditional healer who says, fetch a quantity of herbs and does the hand like this, whose hand are you going to use in measuring? Okay, so they are right on that score. But I mentioned earlier, looking at the belief of the person who has gone there, okay, he may believe that just by putting a certain amount of herbs there will work. Now, what we advocate is that there's a limit to which the prayer camp or the traditional healer can work. Why don't you collaborate? Why don't we build the relations between the mental health unit and the traditional healer so that when a patient is brought in, for instance, the person comes in very aggressive, at the prayer camp or in the home of the traditional healer, the only remedy to aggression is to shackle the person. Why don't we bring in the mental health officer who can come and administer some first aid that the person relaxes, the person sometimes even sleeps off, and when he gets up, the aggression is gone. And then you can now continue to say your prayer. Our focus is not on who claims victory or of having been successful in treating the person. Our focus is in the individual getting well and being treated right as a human being. So we try to foster that collaboration. So when we organize a training, for traditional healers, usually it is the mental health staff we bring to facilitate and then also build that relations. I remember, I will not mention off air, there are traditional healers who have numbers of mental health officers and will call on them, I've received this patient, can you come and do this? Let me say, there are others too who are still stuck to the old age belief that yes, we will not want to have anything to do with the hospital. We'll go on doing what we do. But as the days go by, it is something that has been practiced for hundreds of years. It cannot be changed in a day or in a year. It's a continuous process. And this is where I think that as part of strengthening our systems, you know, it could be a whole topic on its own. As part of that, we should look at that collaboration that we can deepen or strengthen the relationship between the mental health unit and the traditional and faith-based healers to see how we can make the treatment of the patient a focus of our attention rather than whose practice is more potent.
Thank you so much. Like we keep saying here, collaborations count. Collaborations count. You can't do everything by yourself. Even the way we are, we say we are social beings, meaning that you may find people who think that yes, they are them and they can do everything by themselves, but at some point in time, it's just the way of the world. Collaborations, partnerships count. Let's make it work. Now, you know, the conversation is getting really interesting in here. Let's come to this year's theme. We're just now finding ways to wrap up here. Mental health for all. Greater investment, greater access. Greater investment, greater access. And that's the part that I want us to talk about. Doc, what does that mean to your outfit?
Now, when we say greater investment, greater access, we are saying that as it is now, the level of investment that is going into mental health needs to be scaled up. You know very too well that it's just in the last few years or so that Ministry of Health, or let's say Ghana Health Service, have started employing, clinical, psychologists into their hospitals. At the time I finished university, there was nothing like that. Even before the mental health law came into force. I mean, you finish and then you find others who are joining other, services without being in the health sector. So that is an area we need to invest in, that we need every hospital to have a mental health, a person there who can also, assist in the process. Another thing is that the investment has to do beyond just even employing mental health personnel into the Ministry of Health. The perception out there, because everybody, including the medics, the medical doctors, they also have an attitude that needs to be changed. Because I haven't worked in a hospital, but I do know, I have colleagues who are medical doctors, and then they tend to think otherwise, that without the orthodox medication, nothing can be done. And that is a serious issue. So sometimes, instead of them referring the person to the right channel, we are rather, giving them medications and letting them go because we think that that is the purview from which you are coming from, that is the best you can do. So that investment has to go into that area too. That their understanding of how mental health is manifested and how you can deal with it needs to change. If you do not have the capability to use a psychotherapy method to help somebody, don't just give medication and tell the person to go. It will not help. At the end of the day, the person will still come back a million times to this thing. Another thing about the investment is that we need, mental health organizations, a number of them who are in the system, to put in a lot of input in terms of training and letting society understand, like what we are doing here. People should understand, radio programs, TV programs, and even community, programs. The access here has to do with, format point of view. If you look at the 3 psychiatric hospitals, which are all located, 2 in Accra and then the other one in Henderson, you realize that they are in the coast.
Yeah.
Nothing, and even Kumasi is just well within the hospital. But up in the northern part of Ghana, there's not even a single psychiatric hospital. Yes, governments in advanced countries may be advocating for community, service in terms of providing mental health, but we haven't reached there. We actually need the traditional, hospitals to be able to assist, so that we can refer people there, and then they will get the necessary help. So this is what I will talk about: the greater investment.
Thank you.
And greater access.
My boss, Mr. David, at your level, what would this mean to you? Greater investment, greater access.
Yes, I think I wouldn't say anything different from what Dr. Mustafa said. There's the need for the government to invest into the sector or the area of mental health, because it's been relegated to the background for far too long. And the other thing is that the burden that people with mental health issues put on the government, the economy, it's even more, huge than whatever investment the government is dragging its feet, of doing. It was predicted as at earlier 1999 that in 2020, the year in which we found ourselves in, depression will be the second global burden of diseases.
Wow.
Depression will be the second global burden of disease. We have, it's an institution that came out, they placed each condition on a scale, and depression was named the second. What it means is that if any one of us finds him or herself in that area, I wouldn't be able to function, to be productive, for the nation to benefit from it. Dr. Mustafa sitting here wouldn't be able to go impact on his students. Mr. Adams sitting here wouldn't be able to do what he's doing for basic needs. So at the end of the day, what happens? Productivity, disappears. It goes down, exactly. So it is better the government or the nation sees the need to invest more into this area, because it will rather gain to invest into it than not. Because if it fails to do that, the chain effects, it's outweighs, far outweighs, their inability to do what they are supposed to do. And when it comes to the access to, they have rightly said, 3 of our biggest psychiatric institutions are located down south, 2 in Accra, 1 in Cape Coast. Though the new Mental Health Act, the Act 846, speaks about community involvement, trying to drift a bit away from institutional care. But that is not to say we should write it off completely, because at the end of the day, for the person to be stabilized, the person must first be taken to the institution briefly before the person will be given back to the community for them to, reintegrate into the, exactly.
Thank you so much, Mr. David. So what Mr. David is saying here is that the economic implications of this issue is, there's an economic weight on the country because there's low productivity due to the fact that when issues like this set in, people basically excuse the word, go to waste, right? They're not as productive as they would have been originally. So there's a need for government to focus on it. Whoever, CSOs, NGOs, yes, basic needs is here. TOLEC is there. Savannah Signatures also is playing its part. But we all need to come in here. Now let me come to basic needs. For an NGO like yourself, I would love to hear what this year's theme means to you. Yeah, you can center on basic needs as you, this institution that works around this area.
Thank you very much. This is a very appropriate theme, especially in the era of COVID-19. If you look at some studies earlier on done by WHO as far back as 2001, it was estimated that globally at that time, 450 million people, were living with various mental health conditions. Now, so if that is updated, you can imagine what that will be in 2020, given all the economic and social crisis that we have around us. Now, beyond that, globally, mental health contributes 13% to the global burden of disease. So if you come back into Ghana, and also looking at the fact that it is estimated that 1 in 4 persons is likely to experience one form of mental disorder in his or her lifetime. So given our number in this room, we're looking at 3. So
now I'm looking around.
Right. So, and then I'm sure as of 2012 or so, it was estimated that 650,000 Ghanaians were living with mental disorder. So we can make a simple arithmetic. If you look at our current population, what that would be. So looking at it in that context, and the fact that the WHO also says that the treatment gap in Ghana is about 98%. So that means that out of 100 people who need treatment, only 2 people are likely to get the right care that they need. So that tells you the gap that is there. And it is because of this huge gap that I think it is important that we call for greater investment in mental health. Basic Needs also would, through a project that was funded by Star Ghana, found out that, they're working with some districts, some 5 districts, confirmed that yes, there was really, the gap was 97%. Okay, so given that, where are the gaps? It is everywhere. And how do we address it? We need to look at systems strengthening. And how do we look at system strengthening? You already mentioned the issue of manpower. How many psychiatrists do we have in Ghana? Not more than 34. And even out of that number, some have already retired. But because of the scarcity of psychiatrists, they are still in, their services are critical, so they are still on board. How many community psychiatric nurses do we have? How many, community mental health officers do we have? How many clinical psychologists do we have in Ghana? Just a handful. So in the area of human resource, there needs to be greater investment. How can that be done? Scholarships, steady leaves, are required to help those who are already in the system, be able to get the needed financial support to train and come and continue to provide the essential service that is needed. When it comes to the issue of infrastructure, that is where we have the biggest problem, apart from human resource. There are communities, there are districts that are yet to be properly served with mental health officers. So you could have a district where you have less than 3 mental health officers to serve a whole district. So what happens to the sub-district levels? And there are some communities, once it rains, they are cut off from the district hospital where they can access medicines or treatment. So that is what makes the business of traditional and faith-based healers to thrive, because there is no other place they can go. So we need to look at that. Then motivation. How are mental health officers or staff incentivized to continue to provide this essential care that is needed? So sometimes we have engaged at various levels, and some they tell you that when it comes to issues of steady leave, they are rarely considered for steady leave. They are rarely considered. So you find that most of them, rather than going to build capacity in the area of mental health, they go into other areas of health. So they initially train as mental health officers. When they go for further training, they come back and they divert to other branches of the healthcare system. So there is that internal brain drain, of mental health professionals into other areas of the healthcare system. Then beyond that, we're also looking at the issue of medication. Big problem. Big problem in Ghana. So what we have been calling for, one is an increase in investment in the procurement of essential medicines. So that at least apart from the three psychiatric hospitals, basic psychotropics that can be administered, can be available at the community level. We're also advocating for the inclusion of mental health into the National Health Insurance Scheme, so that patients, at the moment, mental health is more or less cash and carry, because the medicines are not there at the facility, and what I require is not covered by health insurance. I have to go and pay for it. And this treatment for mental health is not just like malaria, where you can go and take your anti-malaria in 3 days you are done. People have been living with it for 20 years, and you can imagine what that means to them. Now let me say that just 1 or 2 statements to summarize. You realize that we need to look at mental health as part of primary health care, where the service can be accessible. We're talking about greater investment, greater access. It can be accessible even at the lowest level of healthcare, so that when somebody at the community where you only have a chief's compound is suffering from mental health crisis, there should be somebody who can at least be able to say that, even if it is a community health nurse, can say that this is a case of mental health, and be able to do the appropriate referral. Okay, so that at least at the primary health care level, mental health care services are available. And how can we do that? This should be rooted in universal health care. If it is rooted in universal health care, then we can say that yes, we are on course. And let's remember that treatment for mental health is a human right, and we need to make sure we go that way, that everything that is fundamental to our existence as a people, regardless of your health status, we need to be accorded.
Thank you so much, Mr. Dokurugu. I think that's a perfect summary conclusion to our discussion on mental health for all, greater investment, greater assets. Thank you, Dr. Hassan. We are so grateful that you took off some time to join us in this studio today. Thank you, Mr. Labi, for coming.
Sure.
Basic needs, Mr. Dokurugu Adams. We appreciate it.
Sure.
So yes, mental health is not a one-man show. Yeah, we have our individual roles to play there, like we saw on Thursday when we talked about self-care. It's crucial that we, make that conscious effort to ensure that we have a healthy mental state. However, we are healthy in our heads. Also, like we've heard here today, there are problems with the system, there are challenges with the system. We hope that this conversation gets to some people who hold the power to do something about it. Mental health is a human rights issue, like Mr. Adams has rightly said. We need to focus on it more because it affects every 1 out of 4 persons. I mean, that's shocking. We need to. It is imperative that we start focusing much attention to this. Thank you, Tolek Ghana. Thank you, Basic Needs. Thank you, Doc. Thank you, Mr. Labi, once again.
Yeah.
Thanks to, I wish you could see, the backing of this. There are lots of people in here. Yes, if I don't mention your name, please forgive me. I have that thing with my head. Maybe it's a mental health issue. But Reverend, thank you. My boss, thank you. Our lady in here, thank you so much.
Yeah.
I have Kesmi FM, thank you. Savannah Signatures, bless you. Bishara Radio, for these 3 days, I mean, everybody I'm acknowledging now has been helpful to this crusade within these 3 days. Bishara Radio, we appreciate you. Tawasu Radio, Fila FM, yes, of course, Ghana Health Service, Ghana Education Service, our honorable gentleman who was here earlier on, and then the Sanagu Health Directorate, we appreciate you. Take care of yourselves. It is crucial. Make sure you are here when next we come to you. We don't want anyone developing any mental health issues. Even when you do develop it, please understand that there are people who can handle it, that there are systems in place, measures in place to manage it. So please seek help. Let's not sit home like we like to do until the situation becomes dire before we look for help. There is help. The fact that you have a condition now does not mean that it remains forever. It can go as long as you seek the necessary help, the appropriate help. If you have any health-related issues, yes, if you feel that you're developing some condition, mental health condition that you don't know about, please, you can call us. We will refer you to these resource people in-house. You can call us through the AGO platform on 5100, or you can directly call the ShePlus call center. It is manned by people 24/7. You can get them at any time of the day. You can find them on 0544 711 799, 0544 711 799, or 050 2863 699, 050 2863 699. Thank you once again for joining us this morning. Please keep a safe mind. Thank you.
Thank you.
Thank you.